Hi everybody, welcome to episode 17 of Drug Talk. As always, I'm your host Garrett Campbell. Today we're going to be discussing a medication known as Citalopram, or by its brand name, Celexa. Citalopram is classified as an antidepressant. Although it can be used for some other conditions as well, we do most commonly see it used for depression. Citalopram is a highly selective and potent serotonin reuptake inhibitor, which has minimal effects on both dopamine and norepinephrine. The ability of citalopram to potentiate serotonin activity in the central nervous system via the inhibition of its reuptake is thought to cause its antidepressant action. Before an individual is prescribed this medication, there is a contraindication that must be considered. If an individual used a monoamine oxidase inhibitor, a medication that we'll discuss in future episodes, in the past 14 days, citalopram cannot be used. In terms of precautions, suicidality is very important to monitor. A suicide attempt is inherent with depression and may persist until remission occurs. Occasionally, these medications may increase the risk of suicidality. Therefore, high-risk patients should be closely monitored during their course of therapy with citalopram, especially in the beginning of therapy, and in some extreme cases, hospitalization may be considered. In individuals with bipolar disorder, citalopram may increase the risk of mania or hypomania. If a patient was to enter a manic phase while on this medication, it should be discontinued. If this medication was stopped abruptly, an individual may experience some discontinuation symptoms. Some of those symptoms are, but not limited to, dizziness, abnormal dreams, sensory disturbances, agitation, anxiety, emotional indifference, impaired concentration, headache, migraine, or tremors. Nausea and vomiting may happen as well. To avoid these symptoms from occurring, it's a good idea to stop the medication slowly in a gradual taper. That is, to decrease the dose slowly over time. Another precaution which should be explained to a patient receiving this medication is the risk of serotonin syndrome. This syndrome is rare but can happen at any point in time during therapy with an SSRI, or selective serotonin reuptake inhibitor, such as citalopram. This syndrome is more common when individuals are using several medications which have an effect on serotonin. However, if an individual is experiencing a combination of the following symptoms, they should be checked out in the emergency room: agitation, confusion, tremors, muscle twitches, or hyperthermia. When this medication is used in patients with liver impairment, the clearance of the medication was decreased, causing an increase in plasma concentration. Therefore, physicians would approach these individuals more cautiously and sometimes use a lower maximum dose. No dose adjustment is required in individuals who have mild or moderate kidney impairment. However, some physicians may avoid this medication in individuals who have severe kidney impairment because there's no data on pharmacokinetics or the pharmacodynamics of this medication in these individuals. And lastly, this medication is not indicated in children under the age of 18. In terms of dosage of citalopram, it should be administered once daily, either in the morning or in the evening, and can be taken with or without food. It's common to see individuals start at a dose of 20 milligrams per day, but if adequate benefit is not achieved, they can move up to 40 milligrams per day. Very rarely, you can see individuals on 60 milligrams a day. However, it's been observed through studies over the last few years that there's not much of a benefit from going from 40 to 60 milligrams, and there could actually just be an increase in side effects. In practice, I usually only see a maximum dose of 40 milligrams. Now, it's important to understand if you're using this medication that maximum benefit can take weeks to months to achieve. Now, side effects seem to happen early off in treatment and decrease over time. So it's very common that individuals find themselves in a place where they're experiencing side effects early on, but not experiencing much benefit. Therefore, they stop taking the medication. For this reason, it's important to clearly explain to patients what to expect upon initiation of therapy. While using this medication, some side effects that people may experience are: fatigue happens in about 5% of individuals, dry mouth can happen about 19% of the time, sweating can happen in 10% of people, tremors happen in 8% of individuals, nausea comes in at 20%, diarrhea at 8%, somnolence at 17%, nervousness or anxiety can happen 3 to 4% of the time, and some people may also notice some weight changes. Sexual side effects may happen with citalopram as well. This could present as a decrease in performance or a decrease in libido or desire. That's all I'm going to talk about today with citalopram or Celexa. As always, this channel is to be used for information purposes only and not to be used as a source for recommendations regarding your personal health care. If you have any questions about this medication, direct them towards your personal healthcare provider. If you think this channel is providing valuable information and would like to help see the channel grow, you can like the videos, share the videos, or subscribe to the YouTube channel. Okay, we'll see you next time. Take care.